Ovation Science is our company. We co-founded it, myself and my partner, just over about 2 years ago, and took it public on the Canadian Stock Exchange. It trades under the symbol OVAT, OVAT. But we've recently had a big change in our company in the last few months, as we have a new product that we've licensed to fight the pandemic of COVID. Now, from our point of view, are not happy about what's going on, but at the same time, we're here to fight that and at the same time earning income while we're doing that. The Ovation Science about us, we like to talk about that. We're really about a transdermal and topical product development company. We're backed by over 20 years of research and development. And what we do is we sell and license our highly effective topical transdermal formulations into both beauty products and healthcare products globally. DermSafe, which is the product that we're talking about today, and the fight against the COVID-19, and hand sanitizer. And we like to talk, we will be talking more about that as we go here and talk a little bit about the science, because really we are all about the science. The whole company is about the science behind this product and all the products we develop. In the summary, which would be to tell you what we're going to talk about today. And what we're talking about is how we're targeting a diverse, growing market and global prospects. And it's happening every day. That I can tell you. We're getting emails and phone calls from companies around the world looking to purchase and sell our product or to license our product. So we have short-term goals right now, revenue growth goals, and of course we have long-term goals as well on both product sales and licensing. This new product is a game changer for us, as are our other products. They're high margin, patented products, and of course, as we all know today, they are in high demand. We have an experienced team with us. We have our executives, directors, and advisors, and we're very pleased with the support that we get from all of them. As I mentioned, it trades on the CSE under the symbol OVAT. Right now, there's 23 million shares out, and very tightly held. A third of those shares are held by management. Well capitalized. Again, our business model is to generate online sales for the products as well as wholesale sales from our own product lines as well. Our out-licensing business model generates revenue from multiple sources, including development fees, licensing fees, continuing royalties on their sales, and sales of our polymer technology, which is called Invisicare, to our licensees. As I mentioned, we have a diversified board of directors, executives, and advisors. And you will see there the list of the directors. Everybody has experience, years of experience, both in the capital markets and in the pharmaceutical industry. The key executive, of course, is Dr. Jim Rosell, who developed the patented technology that we have, Invisicare. We have a medical dermatology advisory board headed up by Chuck Lynn, professor of Department of Medicine, University of Toronto, and the other names are also world famous in the dermatology space. Now, the key investment highlights of what we want to talk about today is the technology. It's patented, so nobody can copy it. We've got over 20 years of research into this product, into the delivery system, and some of the products. We're patented in 11 countries, including both Canada and United States and others. The product that we're presenting today, the key product, is DermSafe, our hand sanitizer. We introduced it in February, and sales are expanding globally, and we're just really excited about that. It offers long-lasting and proven ability to kill both bacteria and viruses, including the envelope viruses. We'll hit on that a little bit later in our presentation, but that's the key right there. We have a U.S. licensee. As you know, we're involved both in, it's all about topical, but a big part of our space is the cannabis space. And we have a major licensee in the U.S. Called Lighthouse, and they're aggressively expanding right now across the U.S. With our products. They have 4 products that we've licensed to them right now. We have a group of over 25 formulations we've developed in the cannabis space, but 3 of our products are in the top 5 every month sold here in the 60-some dispensaries here in Nevada. We have a prolonged business model. Our cost of goods are under control. I'm not sure if I like the word low cost of goods, but they're under control. And royalties are based on sales of product by licensees. And of course, we earn revenue from the sale of Invisicare polymers to our licensees. I mentioned we have a very experienced management team, over 75 years of combined pharmaceutical product development expertise, as well as the whole management, as I mentioned, has lots of experience both in finance and in marketing. Now, here's the key. The key is, and this is the unique story that we're talking about here, it's called Invisicare. It's the technology that makes all of our formulations different from every formulation on the market. The patent has to do with a mixture of what we call hydrophobic and hydrophilic polymers. Typically, water on your skin, your water is such that it would wash off. It would hit and go off your skin. We're able to hold water-based products on the skin because of this patented formulation. That's the key on this product that we're going to talk about, DermSafe, and all the products that we've developed. So there's a list of some of the benefits there: skin binding, superior delivery, stable ingredients. We can control the release of the active ingredient. In this case, DermSafe, chlorhexidine glutamate, we can control the release of that over time instead of dumping it all on the skin, as they say. We can control that over a period of 4 to 6 hours. That means that that product then is there to work for that extended period of time. Now, here's just a couple of slides to verify some of the things I've said about the ability to hold active ingredients on the skin and to provide safety to the skin. The first study was done by California Skin Research Labs. It shows that we want to be able to show people that when you put this product on, that it stays on. So there's a scrubbing process they did there with ammonium hydroxide, and at 10 minutes, 2 hours, and 4 hours. And at 4 hours after post-application of our product, and then the scrubbing with ammonium hydroxide, there's visually, you can still see the Invisicare bound to the stratum corneum, bound to the skin's layer. The next one is the skin moisture study, also an in vivo study on 20 subjects. And what we were able to show here is we wanted to show how the Invisicare polymer technology could hold the skin's natural moisture in. They had 20 subjects. They washed their hands 30 times a day for 10 days. 30-second wash and rinse 10 times a day for 5 days. Kind of like what's going on right now when everybody's washing their hands and everybody's saying, hey, you know what? My hands are a mess. I need help. What can I do? If they'd had our formulations of products, including our DermSafe product, you would see that what happened there was the natural fact that people who washed their hands without our product on, the red line there, their hands got really, really bad. And actually 4 of them had to drop out of the study because their hands got so bad. The other one, the blue line, shows that the people used it. In actual fact, the moisture content of their hands got better. Now, think about that in the healthcare setting. Our first responders right now, that's one of the biggest complaints you see on television, on the news, is their hands are a mess because they're washing them and putting alcohol hand sanitizers on their hands. Here we are. This is my favorite product, DermSafe. As I mentioned earlier, we have global orders. We've shipped to China. We've shipped to the UK. UK continues to order. Canada as well, with additional orders being received almost every couple of weeks, major orders. We've received requests from countries like South Korea, Japan, Israel. They're all listed there, Colombia, Mexico, and we are in discussions with different companies in these countries for licensing of our product. And so that's exciting because that'll take us globally a lot quicker than we could do it all ourselves. Right now, we're sitting over $1.5 million worth of DermSafe inventory ready to ship. We're in the production right now of another 1 million units, and we will take that into the Canadian and US marketplace, as well as international. In Canada, where DermSafe has been approved by Health Canada under the new disinfectant and hand sanitizers accepted under COVID-19 interim measure. We have 2 drug identification numbers, DIN numbers from Health Canada already. First one's for personal use, second for personal commercial use, which is businesses that could use it for their employees to protect them against COVID-19. We're backed by science. All of the studies we've done, and we can't go into them all, but I can tell you we've spent hundreds of thousands of dollars of studies, both in the US and internationally, on this particular product to show that it kills not only bacteria like MRSA, E. coli, C. diff, those are real issues in hospitals, as well as viruses like H1N1, the swine flu. Remember that one just a few years ago, H5N1, the bird flu, and of course the yearly influenza virus. Now these are all envelope viruses. There's no study out right now to be able to do on COVID-19, but it is an envelope virus. It's an added level of defense, our product, which because we inform an invisible glove on your hands. Proven protection, chlorhexidine glutenate is an ingredient used in hospitals worldwide for over 60 years. It's used in all the soaps in the scrub up rooms of every hospital. Why? Because it kills both gram-positive and gram-negative bacteria and viruses. Alcohol-free, it won't dry out your hands. CH gene is also known for its ability to bind to the skin and stay on the skin. And as I mentioned already, to kill those viruses and bacteria. Now, just to touch on our CBD line of products, in the cannabis space, we have a complete line of wellness products. You can see them there. And we have a complete line of beauty care products as well, and Vibe and Arlo CBD. I mentioned earlier, we have a licensee in the US. They have an exclusive license to dispensary market in the United States. Non-exclusive out of that, they're called Baskin is the name of their product line. And as I mentioned, it's the #1 best-selling products consistently every month. 3 of the products here in Nevada. And so we, in our case, I mentioned earlier about how do we do this? We developed them. These products we license to them, and they put them into the marketplace, and we're in royalty income from them. Ovation does not sell ourselves or distribute any products that are in violation of the United States Controlled Substance Act. The company does not sell us in visitor care, or does, I should sell to the licensees. As I mentioned, this is the United States. We're also looking internationally on this, on our discussions, both in Canada and internationally with companies now. Now, here again, a wrap-up of the Ovation products, CBD and Cannabis Division, the Vibe MD, Arlo CBD, and our licensee is called Baskin. Now, the reason I think that we're all here today really is to talk about the growth of this company, where it can go with DermSafe. I mentioned already we have international interest and are working on that as we speak. Where market demand is going to continue to grow. The fear is not going away of this pandemic. Now, we're not here to build on it because of this, but we have a product that can help with it, and I think that's important. When I think about the nursing homes, I've been reading articles out of Canada, and it's international in the United States as well, of the nursing home situation, and it's very, very sad when I think that I would have a loved one in there, a family member, and then I couldn't see them, and then at the same time it's running rampant in some of these nursing homes. We need to get the product in there badly and as quick as we can. We need to get people back to work, and they're going to want protection when they come back to work. Think about this for a minute. When a company opens up the doors and says to employees, okay, everybody come on back to work, we're back in business again, they're going to be concerned about their health and safety. They're still going to be thinking about the 6 feet distance or away from the people, or 2 meters from the coworker. Wouldn't it be nice if the employer had the DermSafe in the big bottle, and we have it in bigger bottles as well as a 2-ounce bottle, and had it at the front where one of the requirements was everybody that came to work that day put the product on. They went for lunch, when they came back, they put it on again. And then they knew there was protection all day long. And I think the employees are going to feel better about that. And I think that the employer is going to feel better too, that he is taking care of his or her employees. Now, as some of the Southern Hemisphere is mentioned on there, just going in the flu season, this is why we're getting so much interest in South America and in Australia. This fall, the flu season will probably come quickly. It could be the normal flu, but everybody's going to be worried and thinking about COVID-19. And we need to be there with our product. And I would appeal to everybody who's listening today, if you know people that should be having this product, let us know. A situation of companies that should have it, let us know, because we'd like to talk to them and make sure this product is in there. Ovation is prepared, we're financed and dedicated to build DermSafe into a global brand and to keep the fight against COVID-19 and keep all of our people safe. Thank you very much for your time today, and we'll be here to take any questions that might be. Thank you.
Thank you, Terry. Excellent. So we did have a couple of questions, and we're going to, let me start with, one of them was, are sales online or at pharmacies in the US?
No, they're not. They're not. In the United States, we're going through a process right now to get approval for the product in the US, and that's ongoing right now. So as soon as we do get that approval, then of course we will be. It is approved by, as we mentioned, by Health Canada. And so in Canada, we're in discussions with many companies about distributing the product, both to the nursing home market that we just talked about, as well as going online. And we have just set up a distribution company for shipping of the products in Canada out of Toronto, and we'll be shipping pallet loads up there next week.
Okay, excellent.
I say up there because you know we're in Las Vegas, although I'm a Canadian.
So I did have someone ask what the retail price of DermSafe hand sanitizer is. Is that set by the distributors or the retail locations themselves, or do you guys have any input on that?
Well, we can control the cost that we sell it to them for. Of course, we can't control the cost of what they're going to sell it to the public for. So I don't have the exact answer what they'll be selling for in Canada.
Excellent. And can you maybe give us an idea of your current short-term and long-term debt?
Our short and long-term
debt. If you
debt. Oh, yes. we have, well, short-term we have no debt. Long-term we have no debt. Oh. We have lots of cash in the bank right now. We did our fine. We're very. I know everybody uses the word, but we're very frugal, and we have our operation in Vancouver. The company is located there with an office there. We watch our costs there, the same as we do in Las Vegas here, where we manufacture that. We don't manufacture, we have it outsourced and manufactured. And our lab is here. We own our own lab and all the facilities, and Dr. Rosell works out of there on a daily basis. But we're very much in control of our overhead.
Excellent. How long does a bottle of DermSafe last?
Well, let me show you this bottle right here. If you can see, this is a 2-ounce bottle or 59 milliliter. And what we suggest is you put it on every 4 hours. And so you would, oh, that's more than you need right there. You really need just the dime size. And then you rub it in like you would any lotion, paying close attention to the bacteria and viruses build up under the fingernails. And then you rub it all on. And when it dries on there and everything else, now you're protected for the next 4 hours. So in this bottle right here, there's 59 milliliters. If you put it on twice a day, it will last you 1 month.
Wow.
The idea, the concept being, you go to work, you put it on, you have lunch, you wash your hands, you come back from lunch, you put it on again, and you head home. You're in good shape.
Excellent. Here, okay, let me just go through some, we've got a lot of questions here.
Okay.
What is the percentage, oh, I'm going to absolutely kill this, chlorhexidine in the product, and how long is it expected to be active when applied to the hands? Well, you mentioned the 4 hours, but what's the percentage?
Actually, it's 2.25% chlorhexidine, equivalent to 4% chlorhexidine glutamate. Okay, it comes from a base. But if somebody does their research on chlorhexidine, now chlorhexidine has been used, I said, in soaps and hospitals for over 60 years. So we know it's safe from a health point of view. But when you put the product on, and some of the studies will show that if you continually put it on and on and on, and we have studies that show it lasts a lot longer than 4 hours, okay? But we're making that 4-hour claim because we know the study. But I'm talking about chlorhexidine adhering to the skin's layer. It will stay on for a long period of time. Continual use will get you a longer protection as well.
Oh, that's interesting. I don't know if you can answer this for us, but we have a question of what are your revenue projections for this year and next?
You know, right now, I could answer that. I could answer it, but I just do not answer that because right now, I think the next 60 to 90 days are going to dictate a lot more of what's going on. As I said, we're sitting on major inventory right now to ship, and this fall, think about this for a second. I don't know a mother or father is going to want to send their child back to school or they're not going to be panicking about what's going on. I think this bottle will be in the pocketbook of every kid, young lad or young lady going to school, and hopefully the teachers as well. Or we, as I mentioned, we have it in bigger sizes as well, where it could be sitting on the desk of the school, where every person had to put it on when they come to work. But it would be certainly in the multi-millions of dollars worth of business for sure.
Excellent. Another question was, are you cash flow positive?
I would think we are right now, yes.
Okay, excellent. How is this differentiated from Purell, for example?
Okay, so Purell is an alcohol hand sanitizer. It has an instant kill on bacteria and some viruses. We have sustained kill on bacteria and viruses. Just think for a minute that if you walked over to the doorknob and they said that this virus lives on hard surfaces, and you touched the doorknob and the virus was on there. Somebody coughed on it earlier or touched it. Now, when you walk away, it's on your hand. If you put the alcohol on, you'll kill it, okay? If you have our product on and then you walk away from there, but you touch it again, what do you do? Do you keep putting the alcohol on your hand every 5 minutes while you walk around? And that's what's happening in the healthcare setting. With ours, if there's a virus on there and you walk up and you touch it, as soon as you walk away, it kills it. And 99% of all germs come from these two guys right here, from your hands. We touch our mouth into your body, come mouth, nose, and eyes. So if we could kill it or get rid of that virus or bacteria before we did that, that would be the key. And that's the difference between alcohol and ours. It's instant in their case, but we have the 4-hour kill.
Excellent. We have someone who asked if there's a DIN number in Canada for this.
Yes, we have 2 DIN numbers in Canada, one for personal use and one for commercial use as well.
Excellent. You'll have to excuse me, there's a lot of questions here for you. Is there retail exposure with regards to distribution? If so, who?
There is none right now in Canada.
Okay.
We are in discussions, though, with brokers on that, and that's being handled right now as we speak.
Excellent. And one of the questions was, is there an expiry date on the bottle for the product?
Yeah, our technology shows us that the product lasts for 3 years from date of purchase. So I think we have 2 years on this product because we wanted to get it out in the market. We put 2 years, but it's 3 years.
Okay, excellent. Okay. And I apologize if you had answered this question, but is it available at any retail outlets in Quebec? I don't believe so, correct? Or online?
Not yet, but we have a broker talking.
Okay, perfect.
Yeah.
So this is both of them are about supply chain, so I'll ask them together. Have you had any challenges with supply chain? And if so, what have you done to rectify that? And what about Amazon as a channel? Okay.
First question is, yes, it's been a real issue with the supply chain and getting, as it has for everybody in this industry. And the biggest issue is getting bottles.
Okay.
So how we're getting around that is we also are looking to introduce into the Canadian market for the fall tubes, the product in a tube instead of in a bottle, because we can manufacture those ourselves or have to manufacture for us and have them on supply. But it's so hard. We have over 1.5 million bottles on inventory right now coming in, but just multiply the value of that, you'll get the numbers that we expect to be selling shortly. But it is hard to get. And the second question, it is not on Amazon, but again, we're looking at that right now.
Excellent. And I think those are all the questions for now. If nobody has any other questions, I'll hand it over to Paul. I'm sure Paul has one or two.
Thank you.
Thanks so much, Terry. Much appreciated. It's a great story, and especially with everybody going through this virus, it's going to be a product that's going to be around for a while. So my question is, when do you think the sales are going to ramp up? Are they going to really start in May once you get your bottles in to you and get them shipped out?
Yeah, I think so. From our point of view, we have a large inventory of finished formulation that we'll be sending to the warehouse in Toronto sometime next week. And then the distribution. We've been so busy in getting all of this put together with packaging and manufacturing and everything else, and handling the questions that come in from people. And I just wish we had more people here to help us do all of this kind of stuff, because there's so much interest. But now we have people, brokers in Canada, who are making contact with a lot of distribution companies, whether from retail point of view or wholesale, to bring that product to market. And that's why the product needs to be in the warehouse, and then we'll start distributing from there. And I'm talking mainly about Canada. In the United States.
Are you going to be building a sales force, or are you like using just like distributors?
Yeah, we're looking at brokers and distributors.
Okay.
Yeah.
I mean, and are they going to be targeting, like you mentioned earlier, the old age homes and the residences? I mean, there's a huge need there, obviously.
Yeah, good question. Well, one of the brokers that we have is already working with a major group that calls on all, not all, I'm sure, but they say most of the nursing home market in Canada. Yeah. So,
all right, good.
Yeah.
Well,
just one quick last question. Sorry to interrupt. Who is your direct competitor that's not alcohol-based?
Well, first of all, under the monograph, there's a number of active ingredients that you can have beyond alcohol, and chlorhexidine glutamate is one of them. And I'm sure there's other products on there on the Health Canada website of other products. But I can tell you this, that nobody, because we have a patent on it, nobody has a delivery system. And that's the key here, everybody, is that you can hold it on the skin and keep it on there, even after frequent hand washings for 4 hours. That's the key. So we can kill this so we don't get it into our own bodies or shake somebody's hand and pass it on. Well, that shaking hands has gone out for a while for sure. Have that protection. I talked to somebody the other day about sports, and when are we going to open up sports facilities, because we're all hockey fans and football fans, etc. I said, can you imagine if you go into the facility and they've got the little single sachets of our product in there, and you rip it open, you put it in your hands, and now you're protected for 4 hours. And they're able to say to people, hey, look, we care enough about our players, we want to protect you too while you're here to enjoy the game. I mean, that is really, really good. You know, for the last, the Olympics last time, in Korea, the Winter Olympics, and previously in the Olympic Games in Rio, we supplied DermSafe to all of the Canadian athletes, trainers, management, everybody. We supplied it for free to protect our athletes. And as a matter of fact, when Canada canceled out of the Olympics on the Sunday, on Monday we were shipping product to Quebec to get onto that boat to get over to Korea when they canceled it. And the fellow in charge of it all said, well, okay, it's been canceled, you're not sending, but can you please send us some to our house? I said, absolutely, it'll be done. And then they asked us, would we be able to use it in our training facilities once we open those back up again? And of course, our answer is yes, we want to do that.
Excellent. Well, thank you very much, Terry. It was very informative. It was a great presentation.
Yeah, Terry, thank you a million. I mean, it's so apropos at this time, you know, with everybody is going through. So if anybody has any questions out there, further questions, please email Sophie or myself, and we can pass them on to Terry and we'll get back to you with the answers. Again, thank you very much, Terry. Much appreciated.
Paul, Sophie, thank you very much. Appreciate it.
And thank you to everyone that logged in today. Very much appreciated as well. Take care, everyone. Be safe.